it's CJ. Welcome to week 4 of your postpartum journey. Can you believe that your tiny human is already almost a month old? Today I'm going to talk about some of the more common symptoms that you might be having, as well as what symptoms are not okay. At 4 weeks postpartum, most women will experience a drastic drop-off in their estrogen levels, which can lead to symptoms such as hot flashes, night sweats, and hair loss. As far as your vaginal bleeding goes, you may be having light spotting, or you may not be having any vaginal discharge whatsoever. You may feel like you still look pregnant. That's because your uterus is not done shrinking yet. Typically, it's back to its pre-pregnant size right around 6 weeks postpartum. And finally, some of you might be wondering if it's okay to resume intercourse again. Honestly, we recommend you wait until 6 weeks postpartum just to make sure that everything is healed. However, for those of you who have no intention of waiting, please make sure that you're using an effective form of contraception. I have had patients show up for their 6-week postpartum visit, pregnant again. And here are the symptoms that you never want to ignore. Heavy bleeding, enough to saturate a pad in an hour, or passing clots the size of a golf ball or a small lemon. If you are having any symptoms of infection, severe pain anywhere in your body, if you have a temperature of greater than 100.4 Fahrenheit or 38 degrees Celsius, flu-like symptoms. If you have symptoms of preeclampsia, which is actually really rare at 4 weeks postpartum, most postpartum preeclampsia occurs in the first week after you have your baby. However, it can happen up to 6 weeks postpartum. So be on the lookout for severe headaches, visual changes, chest pain, abdominal pain, or shortness of breath. And finally, worsening depression. At 4 weeks postpartum, your hormones are still fluctuating. You're tired, people are giving you advice that you didn't ask for. You are allowed to have the occasional bad day, the occasional meltdown. That's absolutely fine. However, if you are feeling sad for more than 2 weeks in a row, you can't stop crying, you wish the world would go away. If you have thoughts of harming yourself or your baby, please seek medical attention right away. I do hope that this information has been helpful, and that if you have questions, you'll leave those for me in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button, or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.